Welcome to Fitness Over 30. I am Omari, and I'm joined by a guest today, TJ Lonergan. Dr. TJ, how are you doing today?
Good, Omari. Thanks.
Glad to have you here. Today we're talking about surgery. And so being in the medical field and me being a trainer, we run across a lot of people who are having injuries and possibly needing surgery. So I wanted to give the public a little bit of idea about some of the things that they may want to do before going to see a surgeon. So we can start with, we'll call it a knee injury today, okay? So this person has a little bit of knee soreness, and it's been bothering them. Let's say they walk several miles a week, and they're just starting to experience some inconvenience. So a lot of times I notice people will go right away to an orthopedist with a situation like that. And sometimes I find that's a good choice, but oftentimes I find that when you have something going on to start, you want to start maybe with the muscle. What's your take on it, TJ?
Sure. Well, my take on that is, in my field, chiropractic, we would be considered conservative care. And then you get into something like surgery, and that's invasive care. So anytime that you're puncturing the skin with a needle or cutting with a knife or doing anything, then it's invasive. So we're not an invasive, format. We're conservative. And to kind of give there's a change in the workers' comp of Ohio State. When it comes to certain surgeries, they want to see 3 years of conservative care before they'll pay for a surgery. Okay. Just because on the outcomes and potential threat for opioid addiction. That's been a new change.
Gotcha. Okay, I didn't know that.
So most people don't think of how the process works. And generally what the process works is you get into anybody in the healthcare system and you get it looked at. Anybody can have an opinion, especially somebody with a license to diagnose. Mm-hmm. And then what will happen next, generally from an insurance company perspective, is they want to see you take some sort of anti-inflammatory and pain reliever and or muscle relaxer. They want to see that you've done that and that didn't solve it. If it solves it, great, then you don't need anything else and they don't need to pay for anything else. If it doesn't solve it, then they want to see you go to a physical therapist.
So the next step after anti-inflammatory usually, so first they start off with a basic prescription to try to alleviate some of the discomfort or inflammation. And then the next step you say will be to see a physical therapist.
Yeah, and whether you go straight to the physical therapist or generally your gatekeeper is your family doctor, you go to your family doctor, then he sends you the physical therapist, and the physical therapist assess you. They give you a protocol, they figure out exercises, they put you through a string of exercises. Usually an insurance company will pay for a month's worth of exercises, usually at 3 times a week or 2 times a week, and then they look at then they reassess and see if you're better or not better. If you're better, then they're not paying for anything else. If you're not better, then they're open to doing something next. The next is usually some sort of imaging, like getting an X-ray of the area or the joint, and then they look at the X-ray or possibly an MRI. Right? So the difference between, like, say, an X-ray and an X-ray is just kind of a shadow. It shows you just kind of basic things. It's quick. Technology now has very low radiation, so for the price, it's a great thing to do to understand what's under the hood. If you have a fracture, it takes a 30% destruction of the bone for that fracture to show up on an X-ray. Versus where an MRI, it's gonna have a closer look at all the soft tissue and the bone, and you only need a 2% destruction of the bone to have it show up on an MRI. But you're going to pay a little bit more. But all those prices are coming down. In your system, and then there's cash.
And I've even heard of a couple of MRI places that have low affordable cash payouts, like as low as $300 for a visit.
Yeah, but it's $395.
$395.
It includes the radiology read, and it's strict cash. They don't want to deal with anything. It's pay to play.
Right.
You're in, you're out, and that's how they make their model work. Then usually when that happens, once you've had that image, that's when you go see the specialist or the orthopedic. Now, if you come to the orthopedic, you're there. He'll do his check. And if you don't have some sort of neurological problem, you can't walk, you can't move something, you have excruciating pain, then they may go ahead and take care of you. Otherwise, they're going to kick you back to the general practitioner or the physical therapist and have you run through the protocols. Take the NSAIDs, take the muscle relaxer, make sure that doesn't work. Go to the physical therapist, make sure that doesn't work. Right. Then you come back to me, and then their job is to figure out whether it's ethical and or legal to do a surgery.
Right.
Either it is or it isn't, and you can go get as many opinions on that as you want. obviously I would always recommend getting at least 2, if not more, and from a different group. Don't stay within necessarily the same umbrella. But your insurance may not pay for that. They may pay for you only get a second opinion from the same group. So I think, if you're really going to do well, you can go ahead and get 2 opinions from the same group, but then get 1 from an outside group.
That's a good
And
suggestion.
if all 3 of them say the same thing, chances are
you need the surgery.
You need the surgery, or
right.
you don't need the surgery. If they're saying different things, then you gotta make a
deeper
decision.
dive.
No physician has a crystal ball or an owner's manual. Sometimes they have a tendency to think that healthcare providers know it all, or some healthcare provider knows it all.
Right.
Generally, that's not the case.
No.
Ever.
Right, that's right. And it's usually
you're in charge of your own health, because that's why you're going to sign that book of paperwork that absolves everybody else outside of negligence from your health care.
And coming from my perspective, being a Pilates instructor, a lot of times I approach it from a little less stringent process. I'm more focused on checking muscles. And one of my first things I do with people that come to see me with knee injuries is I recommend them, after I check them and I find where the tightness is coming from, I refer them to a massage therapist right away, because I think that's a vital step in the process to making sure that everything is not pulling on the structure. So if the muscles are tight and they're pulling on the structure, a lot of times that can cause discomfort. If we can get that muscular tension to release, a lot of relief usually comes. Do you have any experience with that?
Sure. So I think that's kind of setting up 2 concepts for people to understand. One is all of healthcare in America specifically is going to make a shift. It hasn't shifted yet. The model is being set by the Cleveland Clinic and the Mayo Clinic, and it's that they have you come in and you don't just see a specialist, get their opinion, move to the next specialist. What they do is they have all the specialists come in and check you. And then as a group, they make a decision.
That's right.
That's where healthcare needs to go.
Right.
Should have always been, but now it's happening. So regardless of what you do, getting better is going to be a team effort. And so if you're getting treated in such a way that it's one group or one way, one person at a time, I would say that's a red flag.
Right.
You should be using all things. Nothing should be off the table. Physical therapist, massage therapist, acupuncturist, chiropractor, it doesn't matter. They all play a part because they're all doing something a little bit different in the body, how it coordinates.
That's it.
So, and all that can be helpful. Some people have, the second thing is then understanding the dynamic of your problem. Is it in an early stage, and is just stretching regularly going to do it for you? Or is stretching plus a massage therapist going to do it for you? Or, stretching plus a massage therapist plus a chiropractor plus a physical therapist? What is it?
It's a combination of something that you need to find that'll help you heal.
What the level is.
Right, that's right.
So if you try the low level of just committing yourself to stretching and that doesn't solve the problem, then there's something more to it, then you got to continue on. And so it's just about understanding that and teaming up and knowing.
We worked on a client together who had a torn, was it ACL?
Yeah.
And, I noticed he came and saw me first, and, I was working with him in Pilates, and he's a runner, of all things, with a torn ACL, and he wears a brace to stabilize. But to TJ's point, building that team is pivotal, because what I found is I started working with him. I could get him so far. I was able to build a lot more stability in him, but it was just a little bit, there was something that was off. And so I thought it was his gait and a couple of other things. So I referred him to Dr. TJ. And after working with Dr. TJ for a couple of weeks, the gentleman then came back and spoke to me, and he said, my coordination is so off. Dr. TJ has shown me through your one drill with the marching that he was just totally off. And so you coordinating the brain into the body, working through the nervous system, we were able to help that gentleman be able to continue and even improve his runs. So to your point, having that team, and we also sent the guy to a massage therapist. So having that team of a chiropractor, a Pilates instructor, and a massage therapist was able to get this gentleman the results that he was looking for. And I know that made both of us happy.
Yeah, and that's the old wives' tale. Many hands make light work. And too much of the time in our system is try one thing till it fails, try another thing till it fails, versus try them together. And so everybody's trying to figure it out. That's okay. The older you get, the more of an expert you become, because As it was told to me, the definition for an expert is someone who's made every mistake in a given field of study.
Right.
That makes them an expert. So you just try to help people out because there's mistakes you don't have to make. And you got a good team around you. Your team is covering your blind spots. You start having kids, and they create more blind spots because more of your energy is on the kid and not on your regular life. Well, who's covering that blind spot? When you're young, you have enough energy to cover it all. As you get older, if you don't team up, eventually you're not going to see something. And it could be you're not going to see it until it's too late.
And I know one thing that you always talk about is pain as being the indicator or a friend of ours to let us know when something is going on. Pain, a lot of times I think people look at it as a negative. But, after dealing with you and looking at the perspective that you bring to the table, it makes a lot of sense that if you don't listen to your body, so if you're dealing with an injury and you're not addressing it, you can probably guarantee over time that injury is going to get worse. So more than anything, what we want to emphasize is take the time to put yourself first. Because if you're a parent, if you're a caregiver of somebody else, you won't be able to be the best you unless you address your own needs. And sometimes that means coming out of pocket. Maybe insurance won't cover it right away. But nothing really matters when your health is down, A lot of times you'll see people worried about mortgages and new cars. But then when you get sick, what's the first thing?
Yeah.
Yeah, none of that matters.
Right.
So, the main thing that I think is to understand we're all going to have things go wrong. That's the process of life.
Yeah.
And so through that process, there is another process that we, along with other health practitioners that are coming into the light, we would like to share with you guys how to be able to discern whether or not I need to have this surgery or whether I have other steps that I need to take. And I think the point is there will always be other steps that you should take before you go straight into a invasive situation like TJ was speaking on earlier.
Yeah, when you do surgery and it is it's invasive because there's going to be permanent change. It's going to be a scar. It may heal well and you don't see it because of a talented surgeon.
Mm-hmm.
Still there. The effects still happen. If they go in, they're either taking some body part out or they're adding something to the body. So it will never be the same again.
No.
So before you go that route, you want to make sure that you understand and are committed and realize that things are going to change. And it's not going to be, you're not going to recapture the same thing. You're going to you're in surgery, you're trading one thing for another. And none of us are getting younger.
No.
So it's how you manage that going through.
Yeah.
In our philosophy of things, we call it the game playing. In the game of life, you have to understand the rules. The M is momentum. So if you got to figure out, how much momentum you're losing or gaining in one direction. Is disease like cancer gaining momentum on you, or are you gaining momentum on it? And so you got to figure out where you're at in that process. And the more people you have on your team, the more momentum you can create to go in the direction you want to go so that things are efficient. And if you don't build a team, then you're going to get all these little paper cuts and blind spots that are going to cut your momentum.
That's right.
By building a team, you keep a momentum high, and things get solved easily, and you're enjoying yourself.
Well, guys, I appreciate you guys for listening today. I think that this subject is one subject that we can oftentimes come back to because, there are so many different instances. This subject is dear to me because one of the reasons why I wanted to start Fitness Over 30 is this very reason. I've seen so many people go into surgery before they have done their due diligence. And so once you make that decision, it's final. You don't have another option once you go under the knife. You're going to have permanent change, as TJ said. I have a broken kneecap that I had, and it wasn't a choice. It was a car accident. So, and of course, that knee it's not the same. You can always strengthen, and that's another subject. That's rehab, and we'll get into that at a later date. But for now, thank you guys for listening. I hope you got a lot out of this. I am Omari. And TJ, do you have anything else you want to add before we close out?
Enjoy the day.
All right, guys. You have a good one, guys. Take care.